Getting a message from the control room. we're 1 minute out. Evidently my staff doesn't go by Apple time. Or the Boxcast isn't set up on Apple time, but we'll. All right, I think we're good to start. I'd like to welcome everybody to our every other week press conference for COVID, and unfortunately probably have a lot to talk about today that I was hoping we weren't going to have to talk about, but we'll start. I've got, of course, Dr. Bill Remington from the Kosciuszko County Health Department, Teresa Reed, infectious disease nurse from the Health Department, Kirk Carlson from Bowen Center, who's handling a bulk of our testing in the county, and Dr. Hoffert from Warsaw Community Schools. So I've got a lot to talk about. I'll just start with a couple things before I turn over to Dr. Remington. I just want to let everybody know that the Indiana State Department of Health sponsored drive-up testing continues at Bowen Center Tuesday through Saturday, and we'll hear from Kurt in a minute. The free CARES Act testing also continues at MedStat 7 days a week in Warsaw and 6 days a week in Syracuse and Napanee. Our free CARES Act testing also continues at Parkview Hospital in Warsaw. So we have 3 free sites in the community that are still operational and busy, unfortunately. Next thing I want to talk a little bit was Halloween. I know many communities are moving ahead with Halloween. I think the precautions need to be stressed as we're looking at, again, a little bit trickier situation, but I think being outdoor, being voluntary, being able to control what's happening is going to make things a little bit easier. I just want to read a few rules that you probably already know. You've heard them all before, but as far as our Halloween goes, please don't participate if you have COVID-19 or have been exposed to COVID-19. Please don't participate if you are a close contact of someone who has COVID-19. Please don't participate if you are experiencing any symptoms of illness, even a cold. And please don't participate if you're a high-risk individual. So the easiest thing to do is, obviously, if you're a trick-or-treater, don't go out. If you are awaiting trick-or-treaters and you don't want to participate, just turn your light off and hopefully you won't be bothered. I think that's probably the easiest way to handle it. Obviously, wash your hands before handling and distributing candy. Wash your hands before opening or eating any candy. Wear a mask. Those distributing treats and trick-or-treaters, wear a cloth or surgical mask or paper mask. Costumes don't provide protection from COVID-19. Costume masks don't provide protection from COVID-19. Use a fitted cloth or disposable mask. And finally, avoid contact while treating. Line up treat bags on a table for kids to grab. Hand out candy instead of using a communal bowl. And build a fun contraption such as a candy chute or a zip line, some way to distribute candy without using your hands. I did see a very cute little sign was passed on to me. It says, "Trick or treat, stay 6 feet, give me something good to eat." So maybe that'll be something people can kind of remember. But I appreciate listening on those items, because it's going to be that's this Saturday night. Obviously much different, but again, on everyone's minds is the voting process. I don't have any whimsical saying for the voting booth. I'll stay completely out of that, other than please practice all of these things as you enter the voting booth. Keep your distances, wear your mask, wash your hands. I've been assured that the county is doing everything they can to sanitize and continue to sanitize the voting environment. When you're done, leave. And again, just try and do it as effectively and efficiently and as safely as you can. And if you can vote early, certainly that would be helpful as well. I know the governor's going to speak at 2:30 today. I'm not certain of whether there will be any changes in the current environment. I haven't heard anything, and sometimes we'll get tipped off if there is. I do know that the public health emergency for the state ends this Sunday, so I anticipate he'll probably extend that either this afternoon or sometime later in the week. So that's really all I've got there. But certainly 2:30, the governor may have more to say about our increase in cases statewide. So with that, I'd certainly like to have Dr. Remington address our local and statewide surge and give his perspective, and then we'll cut to Teresa Reed and Dr. Hoffert and talk about how we're doing in the schools, and then Kurt on our testing. So Dr. Remington?
Sure. Thanks, Mayor. We are clearly experiencing a real surge of cases. Our cumulative case volume has now exceeded 2,000. 2 months ago, we crossed the 1,000 patient mark. Our first case was the 26th of March that we confirmed. Our death count, unfortunately, continues to climb to 29. If you look at weekly cases, a 7-day rolling average, we're up to 344 cases per 100,000 residents, as per an email to me this morning from the state epidemiologist. We are certainly experiencing a local experience that's noteworthy across the state. And we're not the only region in the state seeing a hot spot. Evansville, that area, and the Marion area has a significant volume. 2 months ago, our cases per 100,000 per week was hovering around 50 to 55. So we're up to 344 now. So that's a substantial increase, the highest number of cases in a week that we've seen ever in this whole pandemic. We have lots of access to testing, and we still at times feel short. So certainly the paradigm of testing is different than 3 months, 4 months, 5 months ago, but our volume of test positivity speaks to real sick people. Our regional hospitals are filling up again with COVID cases. I've been on the phone with my own personal private patients hearing bad stories like I haven't heard throughout this whole thing in the last week. So I ask citizens of our county to really respect this. It's not just a statistical thing. It's not fake news. The acronym SMASH comes to mind: social distancing, masking, avoiding crowds, staying home if you are sick, hand washing. Think like that. Please be a good citizen and think like that. It takes your vigilance to think like that. We need to think of ventilating indoor spaces carefully, be mindful of trying to avoid, if we can, social congregated settings indoors. Think of immunizing against influenza. It doesn't prevent COVID, but it's a good thing to do. It will help decrease the burden of ill people with fever, cough, and body aches and feeling crummy in the weeks and months to come. It's going to be really hard to sort out what's COVID, what's influenza. Please strongly consider influenza immunization now. We hope to have COVID-19 vaccine before the end of the year. If we do, it probably will be doled out first to those on the front lines of delivering care to COVID or COVID highly suspect scenarios. So first responders, hospital workers will be the first rollout, and nursing home patients, nursing home employees. So there will be an incremental rollout of this vaccine. Details are unclear. Timeline is unclear. The number of products is unclear, but there will be vaccine. I cannot imagine that a vaccine will come our way in this modern era that would threaten us. So when vaccine comes, all of us will want to look at it carefully, but trust the science. It's robust. It really is. very sophisticated processes of looking at these vaccine products. But we don't have them immediately, so it's not really the discussion perhaps for today, other than get a flu shot, which is available and is trustworthy and is very safe and will help decrease your risk from a seasonal famous virus. Thank you.
All right, thanks, Dr. Remington. I'm sure there'll be some questions as we move along here, but for now, let's turn over to Teresa from the Department of Health and Dr. Hoffer to address the situation in the schools.
Good morning. We have been very busy with the schools because the schools are a place that isolation and quarantine, the call center, people can have some choices whether or not they pick up. The net around the schools is a little stronger in that we at the health department can monitor and pick up whenever there is a child if we see a child that looks like they are school age and they're positive in our county, we're going to find out where they go to school. Where are they? What's going on? And so sometimes people are surprised because this one's a little more invasive than the people who can just evade the call center. On evading the call center, I would really ask that people strongly consider picking up or calling the call center back when they get those tests. In Kosciuszko County, a lot of people do not participate in that, and that's making control even more difficult outside of the areas that we can control, like the schools and the nursing homes. Those have extra measures in place that take it beyond the individual's realm of being able to control. There is the text message that comes from the state. If you get it and you are concerned that it is spam, you can always Google the phone number that's attached to it, and it will bring you back and show you that that is the actual state site number. And so that would be one of the ways to double check that if you're avoiding taking that call because of it being, you're worried it's spam. And beyond that, it's much more difficult. It's challenging because people choose to pick up or not. In the schools, though, I could only look at the last 2 weeks because of how rapid things are moving. In Kosciuszko County, there were 59 cases that fit the criteria of either being school-aged or employed by the Kosciuszko County Public Schools. That 59 cases, 447 people were quarantined during the time frame between October 12th and October 27th. Technically, that's 13 days, sorry. The case numbers, I know what they're going up. This week is on par to be at least as high as last week's numbers, so that's not a really great thing. Out of those 59 cases, this time we have a severe case in a staff member. And so we wish them well and hope that they get well soon and that they recover fully. But that has been a little different. Out of the last 2 weeks, it was 16 asymptomatic, 22 were very mild, so they were sick less than 4 days, 1 mild, 1 moderate, 1 severe, and 12 were too early or unknown at this point in time. So the cases in the schools add up similarly to what we've seen with the other. Previously, we have had a change in one of the metrics in that early on we would hear a lot more, we could tell where they picked up the disease, and especially in the smaller children. And we're seeing that shift to more people not knowing where they picked it up. That does make sense to me because we have sustained, widespread community transmission. You can get it one place or another, and it's much harder to tell exactly where that comes from. But that's what we're doing. We're staying on it. We're keeping, hopefully, everything as safe as we can in the schools, trying to avoid that potential for transmission and keeping it as safe. And I'll let Dr. Hoffer go from there.
Sure. First of all, I want to give a big thank you again to Dr. Remington, Mrs. Reed, Mr. Mayor, thank you for inviting us and letting me be a part of this once again today. I also want to thank our community. We are over 10 weeks into the school year and we have stayed open. We have not had to modify schedules yet at this point. We've been able to host sporting events. We've been able to do that safely. but that doesn't come out without a warning for the future. As we see this uptick in numbers, we fully understand that everybody, teachers, administrators, community members, parents, students, there is a COVID fatigue that is going on. And we've seen that here in recent weeks. And as we see some of these upticks of numbers, please understand that our number one priority is making sure that we stay open and open fully and open safely. And as we look at it, I mean, we look at why we need to keep our schools open. We look at the mental health. We look at the academic pieces that we're still even making up from this last spring. There's a social emotional piece that goes with it that you know, adolescents just need to be able to communicate with each other, but we need to be able to do it safely. We also understand that there's a community aspect when it comes to the economy that has to happen, especially when we're talking about younger children. And so it's why our priority really goes on the safety measures that have to be put in place. As we start seeing some of these upticks of numbers and the numbers that Mrs. Reed just shared, I want to send out a reminder that those are all community-wide numbers, so that's not just Warsaw Community Schools.
Yeah, not just Warsaw Community School, yeah, that's all the schools. All the schools are involved in that numbers.
So again, those would be all school-age children. Our numbers are much lower than that, again, when we look at just Warsaw Community Schools. But again, there are numbers. There are numbers, and we knew that there were going to be numbers, especially coming out of fall break. We really tried to put out a number of warnings of be careful when you travel. We know that that's a traveling holiday that happens. We also know that can be a big gathering weekend, and I do know that there were a number of large gatherings here in the community over this last weekend, and out of some of those, we have seen some impacts that have happened. And we want to remind people that when impacts happen in the home, in the family setting, that can't help but impact what goes on inside of the school setting as well. Because if mom and dad end up being COVID positive, most likely being underneath that roof, the student is either quarantined or unfortunately, and a lot of times does become sick. And while it might not be as deadly because they are not at the highest at-risk population, it does impact what happens in the school. And again, that's where we have to be very careful with spread. When I say that, again, I really do ask our community for grace. We're going to be putting out a community letter here in the next couple days that just reminds people to stay vigilant, especially as we start getting into the colder weather that is out there, that just take the extra precautions. You know, when we look at things in a spectrum, we really look at it, and as things have to get tighter, the first thing that would get tighter would be our community events. Because again, that is our non-academic setting, that's what's happening. And once again, we can live stream things. We want to be able to hold as many of these things in person as we can, but please understand that any limitations that we put on those things are just to make sure that we keep our school doors open. If it was to have to move past that, again, we have plans for different modifications. A lot of other schools around the state have made those modifications. Those are not ideal things. They are not areas that we want to go, but again, if it had to, we would be taking a look at the data, really working with Dr. Remington and Mrs. Reed, and saying, what can we do to be able to alleviate if there were specific hotspots? And I do want to reiterate, at this point, we are not there. We do not want to go there. But again, we realize that we have to watch things very closely, and we have to care about the safety, once again, of our students and of our staff, because our staff is probably a little bit more of an at-risk, high-risk population. Number three, I don't even want to go there, because again, that looks back towards March and what that could look like. And again, I believe that we are past that. I believe that we know a lot more about those things. So again, we don't even really want to go to those places, but please understand and please be gracious with our teachers, with our administrators, with our school board members as we look at these decisions. Once again, these are unprecedented times. We said that all spring, and again, we know that people have that fatigue and just really want to get back. People have asked me, they've said, Dr. Hoffer, what are some things that we can do to help support the schools? And there are a couple things that are out there. Nationwide, there is a substitute shortage. So again, if somebody is interested, and it's a great way to volunteer, there is a little bit of payment that comes with it, being a substitute. It is definitely not $1 million job, but it can be a very fulfilling job. And we have a substitute service. It's called EduStaff. You can go right on our website, and really you can pick the days that you'd be willing to come in and work. You could pick the grade levels that you'd be willing to work with. Now, once again, all of our substitutes go through the same protocols that our teachers do. Please don't come in if you're sick. Please self-monitor your symptoms. Please make sure that you have not been in close contact quarantine. Mr. Mayor, I liked your long list that you had there, because I feel like I'm a repeating parrot every day giving those type of things. But if you could volunteer in that way, that is an excellent way to do it. Another thing that's just really simple, please thank our teachers. While there's a fatigue in the community, there's a fatigue with our teachers too. We keep using the analogy that we've asked them to go back to teaching styles of the 1980s. More spread out in the classroom, straight rows, not being able to do as much group work. Even when we talk about things like science projects, usually kids are sharing kits, collaborating, coming together, and we have to limit a lot of those things. What used to be a one-step process now takes 20 steps to be able to do. And this gets frustrating, and it wears on our teachers. And so just a simple thank you to them goes a really, really long way, and letting them know that you support them, you appreciate them being frontline workers every day and being there, even with some different at-risk populations that are there. So with that, again, we do just encourage people to stay vigilant. Please understand that any modifications that we make are truly to make sure that we keep our schools open, functioning, and healthy.
Thank you. I appreciate it. Before I turn it over to Kurt to talk about testing, I did want to review just where we're at with free testing in our community since we initiated it back in June. And with our MedStat, CARES Act free testing, Parkview participation, free testing, the 6 weeks of Indiana State Department of Health drive-through testing down at Central Park, and now 8 days of the Indiana State Department of Health sponsored clinic at the Bowen Center. You know, we're pushing 6,000 free tests that we've offered, that we've actually had the community take advantage of since June. And obviously our goal is to continue offering that free testing. So I think we've kind of patched things together. I know Kurt's going to talk about the overwhelming utilization, if you will, of the new site, and I think that tells us we're at least doing something right. We're offering it in a culturally sensitive way, in a way that's easy to access, and they're taking advantage of it. So, Kurt, with that, I'll have you give us the Bowen Center update.
Okay, thank you, Mr. Mayor. And again, thank the Health Department for being so supportive. We opened up on, the first day was October 15th, seeing 102 people the first day. We anticipated 25 to 50 a day for the first week, so already we met the state expectation of 100 per day. Since then, as of yesterday, we've tested 1,401 people. And our highest day was yesterday, 332 in one day. Now that's 3 times the state predicted average. Looking at the days of the week, and now after getting close to 2 weeks worth of doing testing, we find our busiest day is clearly Tuesday. The first Tuesday we did 228. Yesterday we did 332. During the week, Wednesday, Thursday, and Friday, other than Tuesday, it's averaging about 120 tests per day. And the 2 Saturdays we've been open, it's averaged 88. So if people want to avoid very long lines, I'd avoid Tuesday. Saturday, Wednesday, Thursday, and Friday are days that it might be as much as an hour in line. We had people yesterday as much as 2 hours in line. And I've got to say, I'm at the booth every day, at the test site every day. Not always the full time we're open, but much of the day. Sometimes I'm handing out the instructions of how to get on the website, sometimes directing traffic, and sometimes managing logistics. And I've got to say, every single person is so appreciative, so thankful, even if they've had to wait in line for hours to get the test. And that's really heartwarming. And as a psychologist, a clinician myself, that's why I do this sort of thing. It's for the people of our community. I was on a Indiana Hospital Association, because we have a hospital association meeting last Thursday, conference call, and it was deja vu from April. All the beds in the ICUs are full. They're hoteling people in emergency rooms, running out of equipment. It was like I say, what we were facing in the spring. So as Dr. Remington mentioned, the surge is upon us again. We are still hiring people. Bowen Center has a number of staff who've stepped up to meet this demand. In addition to those we hired specifically to work in the testing site, we are still looking for bilingual individuals. Yesterday, amongst that 332, 44 persons were Hispanic. We're also looking for volunteers. So far, there's one person who has stepped forward and volunteered. Hopefully, he'll continue with us. And we're not going to limit it to bilingual. That would be a preference, but not an absolute necessity, because we clearly need to staff up to meet this growing need. I think that's it, unless there's some questions anybody has.
No, I think we'll go ahead and open it up for questions. Anyone from the press, if you do have a question, please step to the microphone up here, or I know, Nick, there's a mic in front of you as well. So with that, we'll do some Q&A and just address those you want the question directed to, please. Amanda, Times Union.
Hello, my question's for Dr. Hoffert. Hi, I have a kindergartner at Jefferson Elementary School.
Yeah.
It makes me really sad that parents can't go inside the school right now. But I know you guys also just held a school board meeting at Jefferson.
Yep.
So can you talk a little bit about the cleaning procedures that you're doing? Jefferson just had their first, case in 6th grade there, so.
Yeah, absolutely, absolutely. And we were very thankful that back in March, Jim Lemasters, April Flitterling, Sam Cook, our maintenance team was really able to get together. We were able to get all of our supplies very early, where some schools struggled and some other institutions struggled out there. We have hand sanitizer, we have electrostatic sprayers, we have Clorox wipes. Each night we go through and we spray and sanitize every classroom. So again, with the electrostatic sprayers, and really what that is that's a vital oxide formula that goes down and it adheres to things. So that's one way. If it is Clorox wipes, it does the same exact thing. So again, we're saying that we're going through there. We use the vital oxide and the electrostatic sprayers, especially in high traffic areas that are out there. We also have cleaning supplies in each one of our classrooms. A lot of our teachers have worked with our students. And again, this is one of those steps that we talked about. When things used to take 1 or 2 steps, now they take 20 steps. So what does it look like to wipe down a desk after you leave? What does it look like to wipe down science equipment after you leave? Things that are good practices. And to be honest with you, I hope that a lot of those practices stay with us. Some of the other things that we've done, we also put in those e-learning Mondays, and we did that for a few different reasons. The third reason I didn't even think about at the time when we put them in place, but number one was doing extra deep cleaning and giving just time for things to settle after a long week of school. So every 10 days we have really one of those off. Number two is making sure that our students stay up on their digital platforms. Same thing with our teachers, that we're continually using those, and that'll make even things like snow cancellations work just a little bit easier. The third part is definitely around contact tracing, giving a little bit of time over the weekends for things to settle down. That's probably been one of the biggest struggles that the school has had. We're very grateful out of the people that have been contact traced and quarantined. To this point, we have not had ones that have come back positive. So, I mean, that's a lot of students when we really look at it, that We've taken extra precautions, and as Mrs. Reed stated at the beginning, the schools are one of those areas that have that high net. I know we've shared that data back and forth. We've also shared that with the state. I know the Wall Street Journal just put out an article that the CDC was considering changes for adolescents with the amount of quarantine time. Now, again, that is definitely not a done deal or anything, but I think that's some of the data that is coming back from the schools. So again, we are definitely taking the extra measures in place to make sure that things are safe, quarantined, and the safest environment that we can possibly create for kids. We also believe that school is one of the safest places, and I'll use fall break as an example. And part of this goes with the fatigue that we talked about earlier. People are social beings, and they want to be able to get together. When we're in schools, again, with our masking policies, the way that we have them right now, with our social distancing in place, it truly is one of the safest places that students can be. When students are getting together for sleepovers on the weekends, or carpooling together, or fall parties, a lot of those same stringent standards aren't put in place. So again, that's one of the reasons why we believe that our schools being open is a critical key to even containing spread here inside of our community.
All right. Mr. Spalding? Ink free?
Just a few questions among all of you. Dr. Remington, how is our bed space and ICU percentage going locally?
I don't have a day-to-day metric to share, but I would say it's pushed, not swamped, but pushed, felt, reconfiguring people, places to put patients a little bit.
Okay.
Our local hospital, but regionally, that's all going on.
Okay. And Teresa, is there any chance you could give us an idea of what percentage of people just are not participating in contact tracing, who choose not to pick up the phone? And
That, it's because that comes from the call center, I try to look at that information, but probably about 60% of people are not participating. So one of the things about being able, from keeping schools safe, once again, this ties into what Dr. Hoffert just said, is that because we can keep a close handle on the schools are actually one of the places I feel like we can keep safer. It's not perfect, but it's better than what may be happening, since the other contact tracing through the call center depends on cooperation from the citizens and picking up the call and cooperating with the call center.
and how much is that hamstringing your ability to really slow the spread?
Because when they started with the call center, we tried following up strongly on anyone that they lost to follow up. What we found is that was not, most people were not being lost unintentionally. They were quite intentionally not choosing to participate, so chasing them didn't work very well. And so does it increase the spread? Absolutely, absolutely. And so that's why, for now, that's why we keep such a tight handle. I feel bad for the parents and things, but this is one of the places where we know we can try to keep the kids safe and be able to keep them open and help that. Some of the other areas are outside of our control.
And do you have a feel for why they don't participate?
One, I have three opinions there. And so one is that there's been people express a concern about, they think it's a phishing operation because they don't like the text message. The text message, even though now the information is out there online, but if they don't know what to do with it, it's easier to ignore it than it is to do anything with it. Secondly, there is a consequence when you cooperate with the contact testing. You will be held to your 10 days out, and they're going to talk to you about your family members and your household, and they're going to tell you that you need to quarantine, and they're going to call those contacts. Honestly, people are not cooperating because they don't want to narc out their family and cause that trouble. it is a hardship right now. And so it's hard to get people to participate when it punishes you for doing the right thing. And then thirdly, there's some, political issues involved in this, and people feeling like they don't want that intrusion into their lives and refusing to participate. That would be the 3 reasons that I probably encounter the most.
Thank you. One final question for the mayor and Dr. Remington. I know both of you are pretty supportive or in line with Governor Holcomb's approach to all of this, but I'm curious what you think of the federal response and specifically President Trump's approach. If you don't want to answer, I understand.
Well, I think initially, I thought the federal response was good. I think it's somewhat been left up to the states. I think the CDC has tried to become the pillar of this whole operation. But as was mentioned earlier, the goalposts keep moving and the recommendations keep changing. And then when you're dealing with a federal response, unfortunately, politics has worked its way into it during election year. So it tends to, it's difficult to try and disseminate and try and understand what's real and what's not. Let's take wearing masks, for example. I hear people say, I don't see one study that says that masks help. Well, what? Medical community's been using masks in the operating theater and in an infection, area of infection for 100 years, 75 to 100 years, and now all of a sudden they don't work, But unfortunately, and I understand it, I've mentioned before, there's anxiety in where this is going with jobs, with school, with childcare. This isn't something that, nobody's wrong, but having a unified strategy is, I'm seeing, becoming increasingly difficult on a federal level when there's so much state and local and political differences. I think the federal response started out and did what they needed to do to get it started, but it's been very difficult to, again, with the goalposts moving, with the changes, with the waves, with the politics. I'm thankful that our governor has taken it right from the beginning, I think, has done a great job. But there's obviously people that don't agree with what he's done. He either has been told he has no authority or that he's not doing enough. So, and then I feel very blessed that we've got local health officials that seem to try and utilize the health data that we have at our fingertips. So I know this is a long-winded answer, but locally, I rely most on who's sitting up at this table to guide us locally through what we're doing. And I think we all take the lead from the State Department of Health and the governor. So I'd say as this thing has evolved, it's been much more state-focused, with the CDC trying to be the guiding ship through this thing. But even then, as this novel virus becomes less novel and we learn more about it, we continue to evolve our thinking. And I'm glad that we're updating what we need to update as data tells us, what is really happening and not what somebody says is happening. So thanks, Dan, for the good question.
I'm not afraid to answer that either. Let me just talk from the science nerdy perspective. Pandemics are tough. Novel pathogens are unpredictable. You wouldn't believe the number of novel pathogens I read in infectious disease journals that come my way that just fizzle out after a few human cases. And this one really has legs. I mean, this is to a scale that our generation has not seen. It's unprecedented, to use that word again. So nobody's going to get this perfect. You can look in the rearview mirror and learn some lessons, I would hope. Messaging gets emotional at times, especially when things are bad, when a city is seeing their ICUs threatened, staff exhausted, weeping, sitting on the sidewalk at the end of a 12-hour shift. You know, that gets you in the gut. Any politician's going to respond to that. Any human being's going to respond to that, and we're going to say things that we may not say down the road. This has been a historic experience for us. We think we just wave a wand in modern society and things get quickly done. I mean, after all, you can go to your cell phone and quickly get some information, quickly order something from Amazon, quickly get a COVID vaccine? Well, gee, maybe not. Quickly have PPE by the millions at that scale? Maybe not. Ventilators by the hundreds of thousands? Maybe not. You know, I was telling a patient this morning, I recall the H1N1 experience a decade ago. There were bad cases in Mexico in March. The pathogen was identified pretty quickly, you know, within a few weeks. A novel influenza. Eyes are open. Here we go. 1918 all over again, you know. And they interrupted the U.S. worldwide manufacturing of seasonal influenza immunization, which was in process for that upcoming winter in April. And we waited and waited at the health department for we were going to get tens of thousands of doses of vaccine.
Supposed to be 44,000 doses of vaccine in August,
Yeah.
all delivered at once.
Yeah, we finally got vaccine, and it was November, kind of piecemeal.
October. Yeah, beginning of
Yeah.
October.
And it was already
75 doses
it
was
was
the first
already out of
batch.
the box, way big by then. You know, and that's even with you know, the gears in place to produce influenza immunization. We know how to do that. So, I mean, this is really something. And you just don't wave a wand and quickly clean it up. Messaging could be better, perhaps in retrospect. I think there'll be some lessons learned from that. When you see it blow up locally, you feel you must try something. And as I've mentioned before in this venue, you don't have that many arrows in your quiver in public health, right? Isolation, check. Quarantine, check. Closing schools, maybe, check. Closing restaurants and bars, outings, travel bans, okay, check, I guess, check. But look how bad it is. We better check these. I mean, what else are we going to do? We aren't sure where we're going in 6 weeks. We don't want that image of the streets of Philadelphia with full horse carts with bodies in September 1918. You don't want that. And we haven't had that. You just don't know where this is going. So I think it's been a robust response. Some things certainly could be better. I don't think you look retrospectively and point too many fingers. I think you learn as a society and a scientific community and move forward. Great question. That's good.
Anyone else? All right. Do have a reminder. We do have a meeting at City Hall Monday night, our normal council meeting, and the meeting will be live. I mean, we will have open to the public. I would ask, though, that the Boxcast is available, and we've been streaming our meetings for a long time, and it seems to be a good way to get that information out. But I just want everybody to know that we will continue our virtual meeting via Boxcast as well as a continued live meeting. The next press conference falls on Veterans Day, which is November 11th. So I've been asked to move that press conference. And looking at the calendar, I'm going to suggest Friday the 13th. And I may get some pushback on that, but maybe that'll give us something good. What the heck? So we'll be back here on Friday the 13th. 10:30. And if we need to get back sooner, as I've said before, if things change, we'll certainly let everyone know. But Kurt, thank you for everything you and Bowen Center are doing.
Absolutely.
You're hitting a home run out there, and I'm sorry to say that it's being overutilized, but you're handling it, and thank you very much.
Well, maybe one comment that I didn't make is the courier picks up samples every single day midday. And twice the couriers have mentioned that they pick up from 5 sites, and we're the 5th one they pick up usually. And that when they pick up the others, we're actually doing twice as many tests as the other 4 combined. And so we're being busy. And we're hopefully meeting the needs of the community.
Dr. Hofford, thank you so much for everything you're doing, leading Warsaw Community Schools, and I know Wawasee and Valley are doing everything they can as well. It's tough times, and with the reliance on our health department and state, I think we're doing as good as we can. I'd remind everybody to continue wear their masks. Same story. So, thank you. We'll be back on November 13th.
Friday the 13th. This Friday the 13th wasn't too great.
Thank you. This is a great venue.
Yeah.
Great way to get the message.